The treatment options for macular degeneration are lifestyle choices are very significant in the best treatment for macular degeneration. Again, prevention is always helpful. So smoking is a very, very big risk factor that if you can avoid smoking or quit smoking, that is very helpful in the damage that essentially occurs or helps to cause macular degeneration. UV exposure, wearing sunglasses when you're outside and helping to reduce the UV exposure that we all experience on a hot summer's day is helpful. But UV exposure is also there in the wintertime, so if it's bright out, it's always a good idea to wear sunglasses. Also, dietary factors can play a role. There have been 2 studies that have looked at supplementation for helping with treatment of macular degeneration and helping to essentially prevent progression of macular degeneration. The age-related eye disease study is the study that looked at this originally. This was initially started in 1992. The first age-related eye disease study began at that time and extended to 2001. And it essentially looked at vitamin C and E and beta-carotene and zinc and basically antioxidants to see how they would affect and help to reduce the progression of more advanced macular degeneration. In about 25% of people, that combination of supplements help to reduce the incidence of progression of the macular degeneration. A second study was then performed in 2006. That study removed the beta-carotene because it was noted that there was an increased incidence of lung cancer in patients that had used the beta-carotene or vitamin A that were smokers. And so there was a higher incidence of small cell lung cancer. So that was removed in the second study, and lutein and zeaxanthin were added as different antioxidants and found to be as effective. So there are options from that standpoint. Also, just eating more leafy green vegetables is healthy. There's typically no significant harm in increasing your consumption of fish that contain high amounts of omega-3 fatty acid, and those are some of the easier lifestyle choices that you can make to help reduce the incidence or progression, again, of macular degeneration. If someone develops the wet type of macular degeneration, then typically those people have to undergo injections into the middle portion of the eye called the vitreous. And the medications that are used for that are essentially modified chemotherapy agents. They help to reduce the formation of the new blood vessels that are basically have weak walls, and they leak and then cause hemorrhage and swelling in the area of the center part of your macula. And that causes more rapid vision loss. Those medications are called anti-VEGF medications. VEGF just means vascular endothelial growth factor, and they help to reduce one of the chemical signals that helps produce these new blood vessels. So unfortunately, those have to be repeated most of the time, but it is a significant improvement as compared to even 20 to 25 years ago, where those options were not available. And as a result, for most people, they do help to stave off the progression of the wet macular degeneration. And in some people, that can be only a few injections, but most often they have to have maintenance injections over time to help not have the recurrence of that problem. If you have any of these problems, please feel free to contact our office for an evaluation. We are happy to take a look and examine you to determine if you have early or advanced macular degeneration or other ophthalmic conditions that might be causing your blurred vision.